male is the daughter of the 95-year-old male.
Okay. And the 74-year-old man who passed away, can you tell us any more about him? What else can you tell us about him?
I don't have the details of his particular circumstances and cases. I believe those details would have been released by the chief medical officer. But it is representing a bit of a pattern that we've been seeing in terms of the number of cases that we've been seeing among the elderly. And in fact, Barbados's socio-demographic situation represents almost a perfect storm for COVID-19 and for adverse outcomes from COVID-19.
Sorry to interrupt, but when you say socio-demographic, could you break that down
Yes,
for me,
so the structure of our population, so we have a large proportion of elderly persons in our population. And of course, we know that elderly persons are much more likely to get really sick and unfortunately more likely to die. We also have among our population a large proportion who are suffering with non-communicable diseases. So hypertension and diabetes in our population are among the highest in the world. So the two of those factors together, the elderly in our population and the large proportion of persons with NCDs, does represent, as I said, a bit of a perfect storm for adverse outcomes.
Now, outside of that, we were hearing, and I think you had started to address this earlier, business places have been talking about deliveries and you know, making stock available, foodstuff, vegetables, those types of things. Has any agreement been reached on that yet?
Those discussions have been going on as of today. I was in a meeting of the subcommittee of cabinet with a number of the retailers and distributors discussing the best means by which we can meet the needs of the population, obviously for food, particularly as we go into the Easter weekend, but particularly also because there has been a period of restriction over the past couple of days. So we have two critical things to address. One, the obvious need to ensure that the population has access to food and to do that in a way that is commercially appropriate. But secondly, to address the challenge of ensuring that we do not see a repeat of the scenes of chaos and basically people engaging in large crowds around the supermarkets. So meeting the public health requirements of physical distancing. And I see we have pulled up some of the charts, or one of the charts that I've prepared, which I want to address briefly. The blue in the chart represents the proportion of our population by age group, and the red numbers represent, or the red bars represent the proportion of cases. And you can see that from the time we hit 50, 51 to 60, right through to 80 plus, the red bars exceed the blue bars. Basically what that is telling us that although 31% of the population of Barbados is over 50 years, we have seen 68% of the COVID-19 cases over 50 years. Now that is a situation of grave concern to us because that population represents the population, as I said, that is more likely to fall ill and very ill and require medical treatment. They're the population that is also most likely to die. Now, we have, from the very beginning, put in place a number of measures to respond to the particular challenges of the elderly and persons with these conditions. We restricted from very early visits at the elderly care facilities. We also, a number of the business places, put in special hours for the retail sector for elderly persons to come and do their business either at the supermarkets or at the banks. And just over the past couple of days, we've introduced a number of passes for persons who are looking after elderly persons, providing care. But even here, we've seen abuse of this. We've seen persons approaching the Minister of People Empowerment and Elder Affairs trying to get passes. And when the investigations are done, those have proven to be illegitimate, that persons are seeking to get these passes, not necessarily to look after elderly folk, but basically for whatever other means they have. Representing the types of behavior that we've been asking persons to not to display and that we've been asking persons not to show.
So since you have found people who have been trying to flout this, what punishment can be meted out to them, if any? The punishment, well, the immediate punishment will be that obviously they will not get the pass if they're found obviously not to be persons who are genuine. But
the flouting of orders or the flouting of directives or the flouting of advice does not end there. I've seen the traffic on the road today and over the past couple of days, and you would not believe that Barbados is under a 24-hour curfew with persons only supposed to be leaving their homes if they're going to do shopping or banking or stuff like that, picking up medication. And when you compare the roads of Barbados with the roads of big metropolitan cities, you see a completely different picture altogether.
Let me ask you this. Is it a situation where people are not quite understanding the parameters within which the curfew is being carried out? You say, is it 8 to 6, 6 to 6, but you can come out after 6 a.m. So is it that it's a little bit confusing? People aren't getting it? Is there something more that needs to be said or done?
No, people know what they're supposed to do. The advice was that this is a 24-hour curfew. You're only supposed to be leaving your home if you're going to the doctor or for medical treatment, you're going to the gas station to fill up or to get a top-up, or you're going to do legitimate business.
Let me ask you quick, what was the response to the call for volunteers?
We've had a positive response to the call for medical volunteers, and we are restricting that call for persons in the healthcare sector because we want to give a bit of respite and relief to our healthcare workers who've been working very long and very hard hours. The response has been very positive.
Can you tell us what is happening with the Trinidadians who are in quarantine?
The Trinidadians, I believe, would have ended their period of quarantine today, and therefore they would have discharged their responsibility from a public health perspective. Whatever they do after that is really their business and the business of the government of Trinidad, because essentially we would have covered our public health requirements in terms of maintaining them in quarantine over the 14-day period.
Okay, I had one more question, but we have to wrap up, so hopefully we can get you back another time.
My pleasure.
Thank you very much. COVID-19 Czar Richard Carter here to talk to us about the latest as it relates to COVID-19 in Barbados. Now, some much needed help is now available to Barbados as it continues to battle against COVID-19. It comes in the form of 100 Cuban nurses who arrived here last night. We hear more in this report.
The team, which arrived at the Grantley Adams International Airport, is made up of intensive care specialists. They will be providing respite care and support to local medical teams on the front line of treating COVID-19 positive patients. They were greeted upon arrival by several officials, including Health Minister Lieutenant Colonel Jeffrey Bostic and Barbados' Ambassador to CARICOM, David Commichon. Earlier today, the health professionals visited the Cuban monument in Paynes Bay, St. James, where they reflected on the lives lost on October 6, 1976, as a result of the bombing of the Cubana airline Flight 455. Accompanying the team was Executive Chairman of the Queen Elizabeth Hospital, Juliet Bynol Sutherland. She explains the Cuban nurses will be deployed as soon as they can be rostered to isolation facilities in need of nursing staff.
Or nursing department and the managers of the various wards and units are literally scratching their heads on occasion trying to figure out how they can make their numbers work and still provide effective patient care. These Cuban nurses deployed to the isolation center will provide us the opportunity to recall some of our staff that are now working elsewhere, and because they have worked in isolation and other initiatives, they're ready and well poised to be able to function effectively in the isolation setting. So we're extremely pleased about their arrival.
Barbados' Ambassador to CARICOM, David Commichon, was also on hand. He thanked the nurses for their invaluable service on behalf of the people and government of Barbados.
When the history of this period is written, that the world will see that the people of the Caribbean, led by our Cuban brothers and sisters,
por nuestros hermanos y hermanas cubanos,
wrote one of the most shining chapters
escribieron uno de los más brillantes capítulos
in the history
en la historia
of humanity.
So far, medical teams from Cuba have been welcomed in at least 14 other countries across the globe as the fight against COVID-19 continues. Ronna Jones, CBC News.
Lorna, thank you. And we're joined now by the infectious diseases specialist at the Queen Elizabeth Hospital, Dr. Corey Forde, who is going to give us now some more details about some of the patients that we have who are being treated for COVID-19. Dr. Forde, thank you very much for joining us.
Thank you. It's a pleasure to be here.
So patients in isolation, what can you tell us about them?
Yeah, so we currently have 52 patients in isolation. Unfortunately, today, as been announced, we've had one further death, and we give our sympathy to the family. And many of the healthcare workers have been impacted by this. Currently, as well, in our facilities across the country, I just need to mention a few clear things. With regards to the majority of the patients that we have in isolation, we're quite concerned because a lot of them are in the elderly population. And as we know from across the globe in this particular outbreak, we're having a lot of deaths within that particular population. We as healthcare professionals have worked extremely hard, even though people have come in these populations and people have been quite well, unwell in those age groups. We've worked pretty hard in that area. What I would say in regards to our patient today is that he was an elderly patient with many other comorbidities as well. And I think due to the work of the Ministry of Health, he was actually found because of the screening programs which we've had. So we were able to track and find him within the population. But more importantly, we have at the Enmore facility, we manage people who are ventilated, who are obviously very ill. And then we have, of course, at the Blackman and Gollop facility, for example, two sections. So one where we have people who are unwell but don't require ventilation. And then we have another section with people who are quite like me or you. What I want to mention particularly is in that particular section at Blackman and Gollop is one where we have a more elderly population who are quite ill. And specifically, one of the patients there at present is actually quite ill, which we are managing at this particular point and venture. I think it's important at the end of this to say that for the average Barbadian to understand a few facts. Given the trajectory of this disease and what we have seen internationally, we're quite concerned about our elderly population, and it's very, very important that every single Barbadian looks after those persons in the elderly population. So there may be people in your neighborhood, in your community, that you actually look after them, see what's going on. But also the caregivers. So the caregivers, if you know you're unwell or you have respiratory illnesses, it's important that you don't just go to visit, but you take care in that.
So take care of yourself.
Take care of yourself. Take care of yourself, but also take care of the people around you.
Also, let me ask you this, Dr. Forde. When we were talking earlier, you said you were concerned about how late some people were presenting as well. That is a major issue.
Yeah, it is a major issue because I think the later, if you look at our cases who are presenting more severe, the later you present, the greater the propensity for you to have a worse presentation or worse outcome.
So this is why people need to look in on the elderly more often.
They need to look in on the elderly, but I'll go a little bit further than this. I mean, the Barbadian culture is, if my mother has to go off to work, for example, and there are kids around, for example, they may have a snotty nose and cold, and you're not really sure what they have. The often thing to do is to send them to the grandparents. But one needs to relook at that in this particular event. I think this whole COVID-19 pandemic has taught us several things, and this is some of the small things that we need to look at. So people are obviously advised, you know, if you have the elderly population, you see they're unwell, try to present for medical care quite earlier, as opposed to wait for much later, because the presentations by that time are often quite difficult. People often have severe pneumonia and damage to their lungs, which makes things much more complicated for us.
Now, something you said as well earlier, that some of the cases presented at the polyclinics.
Yes.
That is what is supposed to happen.
Yes.
Is it?
So at the segment of the polyclinic, some patients will be sent there for early swabbing for identification, and they'll often wait for the results, or if they're well enough, they can go home and we'll get those results and contact them and put them into isolation as so desired. So I think overall, every single Barbadian has their role to play, and particularly within the elderly population, we have a distinctive role to play out there in the community. And I challenge every Barbadian as we go through this outbreak to stay at home, stay in, as is requested by all the healthcare professionals, but also look after the less fortunate persons among us in the community.
My last quick question, were you able to trace anybody who came into contact with the 81-year-old who passed away?
Yes. So we're still in the process of tracing, but we were able, I should mention pretty quickly, that we were able to find for the unfortunate person who died today, we were able to find the source of his infection, which was a traveler coming in from the U.S., which he was directly related to. She came in and she was one of the most sickest patients that we've seen very early in the disease, and I'm happy to say today that she's walking around and well at Batman-Gallup.
Well, thank God to hear that.
Yeah.
Thank you very much, Dr. Corey Forde, the head of infectious diseases program at the Queen Elizabeth Hospital, there speaking with us.